Today, I'm going to be covering preventable causes of maternal morbidity and mortality rates within a main focus on Poland and the United States. One of the sections I am going to be looking at is demographics of health issues affecting women. Some of the research questions I am going to be asking are listed on the slide. One being, how was it handled in the past and how is it being handled now? Have the numbers gone up or down? As well as what type of health issues can cause maternal morbidity, as well as what health conditions are aggravated by pregnancy. One of the main questions I'm going to be assessing is how accessible is prevention and treatment for certain maternal morbidities? What does accessibility and affordability look like? Another section I'm going to be looking at is the demographics of countries. What in the US helps to prevent and contribute to these rates, as well as what in Poland helps prevent and contribute to these rates. A subscript from one of the articles I found when I was doing research is one representing Poland that says 2 deaths in every 100,000 birth rate in Poland. One from the US that I found says the US has one of the highest maternal mortality rates in the developed world. In addition, there are extreme racial and ethnic disparities in rates of pregnancy-related death. For the section Cultural Similarities and Differences Among Women, I am going to be looking at the safety within both locations and if it's harder or easier to receive appropriate care surrounding what geographical area that you were located in. I'm also going to be looking at exercise rates during pregnancy and if lower exercise rates lead to more issues with pregnancy, as well as age factor, geriatric pregnancy, abortion rights, child limits, average children, and conception issues. From two of the articles I found regarding this section, one was from Poland and one was from the United States. The one from Poland states, a subscript from it states, in this study, women mostly consumed fruit, salty snacks, dairy, sweet drinks, and desserts between meals, and much less frequently nuts and vegetables. From a subscript from the United States article states, women who report prudent or health-conscious eating patterns before and or during pregnancy may have fewer pregnancy complications and adverse child health outcomes. I'm going to delve deeper into this issue and see how both diet and exercise affect women differently in both of the countries. Ethical considerations in action. Some of the research questions I'm going to be looking at for this section consist of, can they do more in the prevention aspect regarding morbidity before it turns to mortality? This is more geared towards the government as well as local and global organizations. Are mothers educated on what signs to look for regarding their health during pregnancy to know when to seek treatment? If they do, is treatment available for them to receive? Some of the articles that I found for this section is one from Poland and one from the United States. The one from Poland states, compared to other European countries, Poland is witnessing an unprecedented retrogression in access to safe and legal abortion. Its recent actions are in direct contravention of the recommendations of UN treaty bodies and other human rights bodies. This leads to the question of how the ECTHR would adjudicate when faced with applications filed against Poland by women who were denied abortion on embryo-pathological grounds. The one from the United States states, states with abortion bans or restrictions experience adverse outcomes including limited maternity care providers, maternity care deserts, higher rates of maternal mortality and infant death, especially among people of color, elevated death rates for birthing individuals of reproductive age, and greater racial disparities in healthcare. For the summary and conclusion, mainly going to wrap it up restating what I found as well as what the two countries can improve on prevention-wise as well as treatment-wise.